session, I will just inform you that our this topic of our plenary session is that SRHR services for youth and adolescents in Bangladesh, overcoming barriers, creating youth power. So the session will be moderated by Ella. So I am going to invite Ella to introduce our other guests and moderate the session. Over to you, Ella.
Okay, thank you very much. Do you all hear me well? Yeah, okay.
Yes.
Yeah, well, very, very good to see you all here in the screen in time. And for me, it's very early in the morning. So it is very dark outside still, but a very warm welcome to everybody here in the plenary session of the 5th Knowledge Fair on SRHR. We will have the focus on adolescents and youth. Well, the title of this session is will be on services, SRHR services in particular for youth and adolescents in Bangladesh, overcoming barriers, creating youth power. And I'm very happy to listen to the earlier speakers because they were talking also about the huge contribution of youth power. We will focus on that as well. I'm so glad to present to you the keynote speaker, Sheepa Hafiza, who is a well-known equality and rights activist, whom I know from earlier times as a BRAC gender expert, and also who was working for ASK. I'm very happy also to introduce our youngest guest, Alyssa Pizarro, who's currently Resource Development Director of World Vision Bangladesh. The objective of World Vision in Bangladesh is building a better life for girls and boys. So as a young leader herself, Alyssa is passionate about encouraging other young women to raise their potential. So thank you for being with us, Alyssa. Our second discussant is Dr. Ubaidur, who is Director of Population Council in Bangladesh. Dr. Rob is also a member of the Bangladesh National Population Council and advises ministers and members of the parliament in matters of population and health. A very warm welcome to you, Dr. Rob. Our third discussant is Dr. Mohammed Jaynal Haque, who's Program Manager, Adolescent and Reproductive Health in a Mother and Child Health Services Unit of DGFP at the Ministry of Health and Family Welfare. A very warm welcome to you, and I'm very glad that you will be here. We are proud that we have someone from the government and 2 NGO representatives to contribute to this session. Now I want to invite Sheepa Hafiza to speak and show us her presentation.
Thank you very much. Thank you very much, Ella. Good to see you again after such a long time. Thank you very much, ShareNet, for giving me this opportunity. I'm very honored and humble. And today I'll discuss on the topic of sexual and reproductive health rights and around youths and adolescents. I'd like to start here from when the world consensus developed in 1995 at Beijing at the 4th Old Women Conference. And in the Platform for Action, we all agreed the whole world agreed through these 40,000 people. The human rights of women include the right to have control over their and decide freely and responsibly on matters related to their sexuality, including sexual and reproductive health rights, free of coercion, discrimination, and violence. And the important thing is equal relationships between women and men in matters of sexual relations and reproduction, including full respect for the integrity of the person and require mutual respect. Mutual respect, consent, and shared responsibility for sexual behavior and its consequences. So looking at here, we can see that sexuality is a central aspect of our life. Being a human being throughout our life, our sex, our identity, our rules and orientations, all are moving around it. Also our experience and the expressions in thoughts, proverb, fantasies, you just name it, poetry, our values, our attitudes, behaviors, rules and responsibilities. And also in this society, in our societies particularly, sexuality is influenced by stereotypes and thinking and practices till today. Interactions of sexuality is very wide-ranging. It's biological, of course. It's psychosocial. It's social. It's economic, political, central. It's cultural, ethical, legal. And it is so overarching of us, our poverty or not poverty, or discrimination or equality depends largely on how we think about sexuality, sexual relations, reproductive health, and how we practice and how we kind of dignify the area. So, for adolescent and young people, for them to know their right to know and choose and decide in areas that they have the right to have access to the information, resources and services around this arena of sexuality and reproductive health rights. Right to understand sexuality, sexual orientation, and gender identity and expressions and risk factors also from unsafe behaviors or unknown behaviors, and also mental health is important. Right of our own body, it is my body and I live it the way I would like to choose to be safe and pleasurable sexual experiences. Choose sexual partners, timing, when, where, whether or not, and when and whom to marry or not, to have children or not, and kind of when and how many. All we need to choose and decide. Achieve all the above with free from discrimination, intimidation, coercion, exploitation, violence, sexual harassment. Equal relationship between women and men in matters of sexual relations and reproduction, including full respect for the integrity of the person. So, this সমতার একটা সম্পর্ক নারী পুরুষের একটা খুব গুরুত্বপূর্ণ বিষয় যখন আমরা সেক্সুয়াল রিলেশনসের কথা বলি রিপ্রোডাকশনের কথা বলি এবং আমাদের ব্যক্তির যে সত্তা সেখানে সম্মান করা একটা খুবই গুরুত্বপূর্ণ বিষয় একইভাবে অত্যন্ত গুরুত্বপূর্ণ হচ্ছে মিউচুয়াল রেসপেক্ট consent and shared responsibility for sexual behavior and its consequence পারস্পরিক রেসপেক্ট সম্মান আমাদের কনসেন্ট এই শব্দটা বাংলাদেশে অলমোস্ট নাই বললেই চলে কনসেপ্টটাও মত আছে কিনা একজন সেক্স ওয়ার্কার মত দিয়েছে কিনা তাকে তার সাথে সেক্সুয়াল রিলেশনশিপ করার একজন স্ত্রী মত দিয়েছে কিনা তার সাথে সেক্সুয়াল রিলেশনশিপ করার এবং এই পুরো বিষয়টা হবে দুজনের মতামতের ভিত্তিতে শেয়ার্ড রেসপন্সিবিলিটি নিতে হবে এই সেক্সুয়াল বিহেভিয়ারের কারণে যে ফলাফল আসবে সেটার কখনো বললে হবে না অমুক বলেছিলেন তাই করেছিলাম, অমুক গা দেখিয়েছিল তাই করেছিলাম, এটা বলা যায় না। And then let us see where this SRHR, sexual reproductive health rights, in SDGs and how it is. So we looked at our SDG goals. So we find 3 which we thought is more relevant. So one is obviously health and well-being. And there is one target which mostly ask us to, by 2030, of course, ensure universal area access to sexual and reproductive health care services, which include family planning, information, education, all those, and also the integration of reproductive health into national strategies and programs. Mind it, it is integration of reproductive health, not sexual health or sexual rights. And goal 4, equality of education. We expected we will find something there. In Bangladesh, there are many educational institutions teaching children about sexual and reproductive health rights, particularly in the grassroots by the CSOs, NGOs. The goal 5, which we call the goal of gender equality, there is only one target, and it's said, ensure universal access to sexual reproductive health and sexual health, reproductive health and reproductive rights, as agreed in accordance to, as I said earlier, Beijing Platform for Action, and also an ICPD, and the outcome documents of their review conferences. So we need to work in this area and with advocacy, so that in our next goal setting, we can highlight and focus on SRHR. Next. Now, where we stand with our national policies and strategies. So in our constitution, it's very clearly said, right to healthcare and medical treatment for all its citizens, irrespective of age, sex, caste, creed, and colors. And this right to health is one of the basic principle of the Constitution. And then we have different policies and strategies. One is National Health Policy, 2011. The one national strategy for adolescent health, which is very current from 2017 till 2030. But there, how men should get involved and be responsive in achieving the goal is not really mentioned. Then another important one, which is very current, Health, Nutrition and Population Strategic Investment Plan, 2016 to 21, which is almost coming towards the end. There also, there's no mention of menstrual hygiene management and services and information for girls and women. And the facilities, this menstrual hygiene facilities at school is not also mentioned, which is very much part of this service provision. Please go back to the other one. The hygiene management, menstrual hygiene management strategy is very in draft, but in all those, understanding sexuality, gender and rights are absent. No mention of boys and men's responsibility. So there is a big gap, because without men, women, boys and girls, this area, we cannot improve the area. Thank you. Next one. Therefore, the relevant statistics are 22% population, although they are adolescent, they are at almost 14 million girls. 63% of those girls get married while they are adolescent. And then almost 1/3 get, pregnant within a year time. And due to all those, in 2020, Bangladesh had the highest number of birth per 1,000 adolescents, which is approximately 83 births per 1,000, which should be a very big concern for us. 40% girls miss their school at least for 3 days during menstruation. And almost majority, like 86% women and girls, they still use these old clothes and unhygienic management of menstruation. Therefore, menstruation hygiene management is yet unknown to maximum, and therefore stereotypes are not challenged yet. In disaster situation like flood, cyclone, waterlogging, etc., girls and women suffer more with, poorest hygiene management of menstruation. And we find out from the published news that in 2019, rape and gang rape of children increased 1.5 times more than the last year. The rape of children was highest for us, informed by the media and others, in 2017. And think about it, it's 1.5 times more from last year to 2019. Have you done anything about it? Then COVID-19, violence against women, children, and girls is even higher. And obviously, menstruation management becomes even difficult, as all the time there are people around in the house. So please, next one. So we have different services. And I found it from all the secondary information. In Bangladesh, there are different organizations providing services, particularly healthcare services, more than the information or capacity building, knowledge building, where people can give consent and make decisions to take inclusive, positive approach to sexuality, which is extremely important. Because
these are the top results.
Because the policymakers, implementers has less understanding of the importance of sexuality. So whatever service provision they implement, it's always become not really from their heart, which is very important when we are talking about human being and the most important aspect of human being, sexuality, sexual relationships, and reproduction. Therefore, the recognizes the importance of sexuality is one of the highest, important aspect for us, and builds strengths for inclusive sexual rights movements through supporting alliances, and at the same time, challenging the gender and other inequalities within and between these groups. So this is wonderful to see this, kind of conferences happening around that. And I would really like to see that the participant, adolescent and young particularly, they'll find out ways and identify how to challenge the gender and other inequalities within and between their own groups. Draw inspiration from and connect with the existing initiatives already happening. All young people, every man, service providers, policy and decision makers to be responsive to address sexuality and gender discrimination, and to learn how to challenge stereotypes, taboos, and social gender constructions to change. If we are aware and we know how to do and what to do, then we can reduce the number of abortion of women and girls who live in the clogged area. And we can also reduce the humongous amount of sexual harassment happening in the public places, and also the increase of brutality in during rape and gang rape. I'm not talking about numbers, but the brutality is really increasing a lot. Numbers was always there. Our media is active for last at least 10, 20 years. So, but now they're focusing on the issues of girls and women's violations. Teachers, parents, and communities has to come together, including persons with disabilities, other religion, other gender, people of marginalized sectors to be involved in policy and action plan making, implementing and monitoring too. If that is the case, then our strategy and plan will be more focused to girls and boys, women and men, and other genders, and other people who are in marginalized sectors. Menstrual hygiene management. I'm so glad that there is a draft strategy already been developed. I hope this strategy, the policies to be placed everywhere where the adolescents and youths are, in schools, in shopping malls, and religious and other entertainment centers, hospitals, libraries, sports, clubs, everywhere. But the access for toilet has to be improved and easier access, smoother access for the people with disability or any other difficulties that people have to enter into a toilet facilities. And for everything, a community-centered follow-up mechanism to ensure accountability is important. Can we just take different villages, different thana, different upojelas, name the upojelas, that we will work on this upojela and we will develop an ideal situation to address sexuality inclusively. And this is possible if young people come in. This really not cost much in terms of money and others. It is your time, your commitment, and the political will of the leaders is so important to have an inclusive approach, inclusive and positive approach to sexuality, sexual relations, and reproductive health. Thank you very much.
Thank you, Sheepa, for this wonderful presentation. I think it is very, well, it is so much. It is a bit overwhelming. And first, I would like to ask the audience also to come forward with questions, because that is also possible. In the screen on the right hand, you could put your questions. And if we have some time more in this presentation and this part of the program, we will come back to the questions and ask our discussants to answer. Well, may I first invite Alyssa to come forward with your first reaction on this presentation, and from the perspective of World Vision Bangladesh, who is focusing on boys and girls. What are your first thoughts regarding this presentation?
Yeah, thank you very much. And thank you, Sheepa, for the great presentation. I think it is a really great consolidation of all the evidence, the challenges, the gaps that we're also seeing. And we see it at the community level, at the most grassroots level, as we're working with boys and girls across the country. And so it's it's certainly reaffirming to us as World Vision regarding the work that we're doing. But as you present just the scale of the challenge, it's a little bit overwhelming. You know, a lot of what we're doing sometimes feels like a drop in the bucket, but it's still worth it, and it just needs to be scaled up. So I'm happy to be a part of this discussion and figuring out ways that we can energize that scale up, because we know we certainly can't do it ourselves with the small programming we have, but we're trying to do the best with what we have. I could go on, but that's just my introductory kind of remarks. So
yes, thank you very much. And Dr. Rob, may I invite you to to be a bit more specific regarding the speech of Sheepa Appa, related to, for example, barriers you noted in your researches done by Population Council, barriers for young people to get access to the many services which are already available in Bangladesh, but they're not very much used by adolescents. I'm not sure if there are any data available about the service-seeking behavior of the young people in Bangladesh.
Thank you, Ella, and thank you for the presentation by Shifa Hafiz. As you know, service-seeking behavior of adolescents are available from different small-scale studies, but national level information is sometimes very difficult because we don't conduct any national level youth survey. But again, it's about adolescent boys, girls, there is a diversification among them whom we are talking, If we think about married adolescent service need different than unmarried adolescent. What we have discussed in this presentation is, gist of the things we are considering. But for the last 20 years, we are discussing exactly the same thing, starting from 2000 till today, 2020. But we have not introduced or invent or, develop a strategy how to reach those areas, the areas where we are not able to do more compared to others, Take simple example, giving information to the adolescent about sexual issues. We still fail to do this thing in school system. And it is very clear that our school system is not teaching or equipping our boys and girls about their sexual and reproductive health needs, which they will be seeing in the next 10 years, 5 years. Similarly, if you think about menstrual management, we have plenty available in the school system, constructing, latrine, toilet, whatever you call it. But question is that water supply is the main problem there. You have, yesterday I was coming from my, tea garden, they have constructed two toilet one for boys and one for girls for one of those school where I stopped just to see it. And I see that they're nicely commode and other things, but there is no water supply. So I asked them from where they will get the water supply, because they were carrying by the bucket. So the question is, the flush there, how they will using that flush with getting water from a bucket. So the simple, things, which can easily be improved the service utilization. The lastly, what I will say that, including boys, or the men in the system, we constantly fail to do this thing. And the problem will not be solved by the NGOs. As my colleague from World Vision mentioned, that we are doing in a small areas. Our reach is very limited, It has to be with government having $3 to $4 billion, health budget. Mr. Jaynal is here and we discuss all these things. You can easily do some of things, but it needs, as Sheepa Hafiz mentioned, the mentality change of our policy makers. They have to consider it is an urgency and then invest accordingly. Thank you.
Yeah, thank you very much, Dr. Rob. Yeah, here we go into the field, and you observed already many elements which are actually, it looks small, but it needs a huge approach, a national-wide approach. And yeah, maybe we could start with the mentality. How is that, Dr. Jaynal? Are you available? You're unmuted.
Yeah.
Okay. Yeah,
okay.
You're there.
Yeah.
So what is the approach of the government? You're working for the Ministry of Health, of course, not for the Ministry of Education, which we need regarding sexuality information in the schools. But what about the health sector? You are managing a huge project related to adolescents. So you must have some information about what is going on in the country.
Thank you. Ella de Voogd also shared net thanks, especially Kishore Bashak, and here presenter Sheepa, and also my Honorable Sir Ubaidur, thanks to all and other present participants here at the plenary session. I'm Dr. Jaynal, Haque, Program Manager at Adolescent Reproductive Health. I'm involved with the adolescent health related issues and nutrition services and reproductive health, especially MR, MRM, and post-abortion care related issues from the DGFP under Ministry of Health and Family Welfare. Actually, this session is very important, reproductive sexual issues for youth and adolescent. I have my experience last few years in this sector. You know that the services for the adolescent and youth has very recently been started in Bangladesh. Although it is not in very much previously from other side, you know that at the beginning of the SDG goal, the global strategy for adolescent, women's and adolescent health, Lancet Commission for Adolescent Health and Wellbeing, it is not very much previous. Since 2012, following that global agenda, global issues, the Bangladesh, we have also adopted to do the services for the adolescent and youth services. You know that the government has already developed a national strategy for adolescent health that is started 2017 to 2030. Yeah. Already in 2017, and also National Plan of Action for Adolescent Health strategy that is from 2019 started, and in 2020 we are in the at the end, nearly end to finalize the costed plan of action for adolescent health 2020 to 2030. You know that in Bangladesh, sexual reproductive health issues, big issue is adolescent marriage, early marriage, and adolescent pregnancy. Then non-availability of taking, you have already mentioned that taking care-seeking behavior is not so much as we think, but the issue is very important to serve this segment of people in Bangladesh, 1/5 of the total population. We have
excuse me, Dr. Jaynal.
Yeah,
I've a bit a more specific question to you related to the website, because Dr. Rob was also talking about providing information, sexuality education in the schools, but I noticed that there is a very informative website organized or established by the Ministry of Health, which is www.adoinfobd.com.
Yeah.
And I think that is a wonderful way to inform young people to get access to services. Now, it was partly in Bangla, so I couldn't read it all, but is there a possibility for young people to get a service to get tested for sexual transmitted infections, for example?
Any more?
Is it possible for young people, for adolescents, to go to health centers and to get tested for sexual transmitted infections?
Yeah. Thanks for your raising issues regarding this website, adoinfobd.com. I was very much involved in the development of this website. you have mentioned the HIV/AIDS infection prevention knowledge and remedy or services for them. Is it possible? I think it is possible, but you know that we have just started since January 2017 these issues through the 4th HPNSP program of the government, Ministry of Health and Family Welfare. So we have taken very much program plan and activities, and we are already developing, already we have developed 903 facilities, especially mother child welfare centers and union health and family welfare centers, and giving training to the service providers. And the youth or adolescent who are coming to them, they are giving information regarding these issues, especially HIV/AIDS program and other issues also. So it is possible, but as most of the people are not to engage with the website, we have much more circulation about the. We need more circulation of this website. If they enter this or use this website, they can be get helpful information from this website, I think.
Yes, thank you very much. I will get back later to you. Maybe I would like to move to Alyssa again and ask her what are the best practices of World Vision in the field of SRHR and young people. Do you have any, well, good results and any good examples for us?
Yeah, absolutely. I mean, I can name a few. As I mentioned, we touch on a number of the different interventions being prescribed, again, at a small scale, considering, you know, just the population of adolescents. It's a start. But so we've actually been able to reach in this past year over 64,000 adolescents with SRHR messaging through community health volunteers. We are also engaging children and youth in what we call child and youth forums, where they can be advocates, activists for services like SRHR that they may be entitled to at the most local level. And they also, in the last 2 years, have been able to stop over 600 child marriages. On behalf of the child and youth forums, the leaders who have been working very hard to advocate for their rights, these young people have been really making a difference in their own communities. So if there's one best practice, it's not really about what World Vision is doing, but it's that youth have energy, motivation, they are making a difference. So how can we support them to do more? And how can we make it easy for them to do that and provide the information and opportunity to do that? So as a result, this year, we're trying to scale up our adolescent programming. So through our core long-term programming, we're engaging over 150,000 children. 55,000 of them are adolescents. So we're trying to, again, scale up our integrated adolescent empowerment program to include SRHR topics. Another aspect or best practice that we also wanted to recommend and put forward as scalable. So based on our work with 1,000 community health clinics across the country, we've seen that they're not always readily able to handle adolescent SRHR topics and health service delivery. We see a significant gap between the ages of 10 to 19 when it comes to SRH. That includes mental health services. But we have also seen that the involvement in faith leaders can be a great area of potential and has had significant impact. We have a model called Channels of Hope, where we partner with different faith leaders to give them certain messaging, to engage their own congregations. So we're working with 1,000 faith leaders who have a reach of well over 100,000 people across the country. And we have seen the great impact that these faith leaders have had in speaking out and even preventing child marriage and early pregnancy. So our recommendation is how can we work with the faith community to scale up these initiatives? Because we know it's also a sensitive topic.
Yeah.
How can we not only sensitize but motivate families and communities to broach this very sensitive topic? I know that we know that it's been done in Bangladesh in the past with the immunization, vaccination taboos, but the faith community, the media were engaged in the past, and now immunization rates are up well over 95%. So can we do that again? It's been done before, and why not? And if we can invest in that 10 to 19 year age bracket, we can directly contribute to the SDG target to reduce maternal, neonatal, child, and infant mortality. So just making that simple investment can reap benefits for the long term. So my final recommendation, sorry, I keep adding them on, but it's a really important one. Those who are either funders or programmers who are implementing programs for adolescents. So recommendation is at the very least, having a cross-cutting theme or approach to SRHR in their adolescent program, or even funding dedicated SRHR programs. Again, that can be scalable, cost-effective, and really make an impact in the long term. So thank you.
Yeah, thank you very much. And do you have any idea what could be barriers for young people to get access to the services they need?
Is that for me again?
Yes.
Yeah, certainly. I think one of them would be a lack of sort of gender responsive services. So we also want to stress that if community health volunteers will be a part of the effort to reach the most vulnerable youth across the country, we should make sure that there are female volunteers so that young women can feel comfortable to approach them. And as I mentioned earlier, SRH is a very sensitive topic. We all know that. So trying to take the faith community route where we can soften the discussions about that and make it more easy to have those conversations at the household level, vis-a-vis through the faith community, who then speak into households across the country. That could be another promising way to make it easier to broach the subject in the home.
Yeah. Are you in contact with religious leaders, for example, regarding this topic?
Yes, exactly. So as I mentioned, as of our new fiscal year, so October this year, we are rolling out our SRH-focused Channels of Hope program where we're engaging with leaders.
That sounds good, Yeah, Dr. Rob, what is your opinion related to the involvement of religious leaders, for example, to reduce the barriers for adolescents to get access to the services they need?
Ella, again, when you mention adolescent, you have to be clear which adolescent you are talking.
Yes, that's right. Yeah.
Reaching female with religious leaders. There is one way of going there, and then reaching boys with the religious leaders is we have to reach another way. The easy access for religious leaders to educate the boys is the madrasa system. We have more than 2 million students are studying in madrasa system. I'm talking about Aliyah Madrasa, the government recognized madrasa. And then you have the Qaumi Madrasa, which is another 500,000, 2 million people, adolescents, So this is a big, out of your, 28 million adolescents, they are covering 4 million boys there, roughly, which you can easily reach them through them. Going religious leader to educate our girls folk, the best way will be definitely we can involve them, but how they will reach them, it is very, channeling system will be a little bit difficult for them to reach them, but definitely they can give sermon and other, religious talk during Friday prayers and other areas. We have tried, as you know, we talk things, but we don't have information. In Bangladesh, at least involvement of religious leader to reach, different groups, we have done at least 20, 30 studies, but in last 2 years, when I was doing a review, I didn't find a single study which had evaluated the impact of involvement of religious leaders reaching in any of these, health-related issues. No, I'm not talking about adolescent, I'm talking about child marriage and others. There is none of them. So I'm not sure, whether evidence are available here in Bangladesh to reach. But definitely in Latin America, there are plenty of, literature available that you can reach religious leaders, adolescents through religious leaders.
Yeah. So actually, according to you, also it will be possible in Bangladesh, but you need some more information and maybe to do some more research on that.
Yeah, research is one thing, but also as Mr. Jaynal mentioned, they are the best group, who can reach these adolescent girls. They have their FWVs, FWAs, and FWAs are visiting the household. Why they don't reach adolescent girls instead of we are sending another group to reach adolescent girls? Now they are only targeting women.
Yes.
So job description could be changed, and this is another issue to discuss. But there are 25,000 family planning workers working in the field and they will be working there for next 30 years. They are the government employees. You cannot just terminate tomorrow. So they will be there in the system for 30 years. And as the number of women using contraceptive is increasing significantly, they don't have to reach all the household like they have to do earlier. Now they can change their mode of operation and they start reaching younger adolescent. Only they will reach married adolescent. I'm talking about unmarried adolescent.
Yeah. Well, let's ask to Dr. Jaynal.
Yes.
Is it possible to get the family welfare visitors involved in providing information to young adolescents and then in particular also to young unmarried girls?
Yes, of course, that could be possible. But we already give the information, advice, counseling, but not giving the service, especially family planning services to the unmarried adolescent in Bangladesh context.
Actually, will that be possible to include this target group in the work of the family welfare visitors, for example?
Yeah.
Family planning worker, not visitor, FWA, not FWA.
FWA who visit at home level. And at satellite clinic, community clinic, they can do this work actually.
Dr. Jaynal, can you change their job description and request them to do work with unmarried adolescent? Right now, job description don't cover unmarried adolescent. Can we do it?
Oh, yeah.
We are trying to solve these issues during this discussion. Everywhere it is discussed, and it is the challenging nowadays. Challenging issues for us. We are trying to resolve these issues. Sir already said we'll try. We are trying to incorporate the job description or giving their directions. Already we are orienting them and giving instruction. By one-day orientation, doing for all level of staffs and teams, our union and Upazila level service providers.
That would be good. That would be a very good outcome of this session. Actually, I want to go to the youth power and the involvement of young people themselves also. Dr. Rob, what are your thoughts about that? To get the adolescents and to make use of the energy and the good ideas, the new ideas and the innovative activities which we could ask for from the young people in this field.
We are doing it, as you know, the CIRAC, I was one of the CIRAC, meeting, and that was connected through Zoom. One thing we right now in accessibility has changed significantly last 9 months, If you think about this adolescent, 9 months back, it was always thinking bringing them to Dhaka or divisional town or district town. Now you can 5,000 adolescent or 5,000 youth through these, all kinds of, reaching medias, I know the Ministry of Information and Technology, they are having different projects reaching these young youth, particularly youth entrepreneurs through different mechanism to educate them on starting business, small business, whatever, their intention. But definitely Ministry of Health and Family Welfare can think now how best we can include this young group, a young adolescent or youth group in our service delivery mechanism through a different channel, particularly as you know, Zoom channel is one of them, and having access to this mobile technology, I think it is easy we can involve them. It needs a different types of programming and different types of actions.
Yeah. Yeah, Alyssa, what do you think about the involvement of young people in the programs which are about them, but not with them maybe? Yeah, what to do, how to involve them in project design, for example. And
Yeah.
making use of social media, probably, huh?
Yeah,
Before Alyssa says, just I'm going to interrupt. Ella, I know that you are well conscious of the time. You
Yes.
have 10 minutes to wrap up all these. And
Yes,
if
thank you.
if you think that you can able to do a Q&A, I have some questions. Maybe I can help you later. So what do you?
Okay. Yes. Thanks, sure. Alyssa, go ahead.
Yeah, sure. Yeah, absolutely. As I mentioned before, there is a lot of potential to engage youth. I think there's a place for different kinds of programming and different approaches, different ways to reach the youth and engage them. There's no one way to do it. But one of the things that we are doing is working through child and youth forums and giving them a voice and giving them more confidence, the ability to advocate for services that they require and advocate for social change as well. But I guess one of the questions I had, again, it's in terms of reach and trying to make our approaches more aggressive and scaled up. I wondered if I could ask the group, what do they think about the involvement of media? How can they also be engaged to accelerate the reach of critical SRHR information and knowledge?
Yeah, well, I think Dr. Jaynal maybe has an answer on that.
Yes, yes.
Of the government.
Yes, I can add something. In addition to Dr. Ubaidur sir, he has also already mentioned many things, many points. I can add here for extensive information for them, counseling for them, that is our conversion of knowledge. This is by the SBCC. The Ministry of Health and Family Welfare include DGHS school-based program, and we DGFP is a facility-based program. And you know that there is the program in the education system, education ministry. Also, there is a club provision, youth club or adolescent club provision in the Ministry of Women's and Child Affairs. We are making integration and coordination among them, and we are given emphasis to coordinate with them. Lastly, I can add you some information for their better circulation of their information regarding. We are making approved IC material. We have already from the government side, also from the DP side, we are getting printing material, and we use them in our around or adjacent our facilities, arrow direction, signboard, citizen charter, etc. And also we making psychosocial counseling training for them. We are increasing supplies, commodities, specialized material for their better information for their
sorry,
knowledge.
Dr. Jaynal, sorry for interrupting you, but is that material also designed and composed with help of adolescents?
Yeah. Already, you know that there is a separate, different level committee, management and coordination committee, adolescent friendly health services. At the central level, the division, at the directorate level, divisional level, district level, oppositional level, union level. All these committees included both male and female adolescent representation.
Young people. Well, that sounds very good. I think we have a very fruitful discussion, and to end up and to wrap up this session, I must say the fundament, the basis of this discussion was laid by Sheepa Hafiza with her presentation, and we really well managed to go into the field and to talk about concrete subjects. I would like to ask Dr. Rob related to the title of this session was how to overcome barriers and how to create more youth power. What would be your advice to the minister regarding this?
The first advice will be give them information. We make information available to our youth group, adolescent group, what they need. You ask the question, can they do STI test? Yes, they can do it, but they don't know where they can do it. They have to go to the district hospital, do an STI test, but most of them don't know. So they will end up in Upazila Health Complex and they will say they will not do a STI test. So provide them information. We don't need information about how to produce rice or how to do agriculture in school. We need information how to manage their health and reproductive issues in future. And we have to have those courses to be taught regularly in the school.
Thank you. Thank you very much. So we end up with information, information, information. I think then with RedOrange, we are in good hands. And with this knowledge fair, I think we can get so much information. I would love to continue with that for the whole day, but actually we had only 1 hour. And I see also some questions in the sideline, but it is impossible actually now to go into the deep with these questions. I would like to thank you very, very, very much, Sheepa, for your wonderful speech, Dr. Jaynal for your contribution from government side, Dr. Rob from Population Council. I hope really that we could manage to provide all the people in Bangladesh more information about sexual and reproductive health and rights. And Alyssa, you are working in the field with so many people. I wish you very good luck and hope to see you again soon. Thank you all and have a very pleasant day.
Thank you.
Thank you very much.
Thank you.
Take care. Bye.
Thank you.